educational opportunities using broadband to help educational problems, and we wanted to make sure that there was continued statewide leadership. And that was very important because none of this would have happened without leadership. And one thing I wanted to quickly mention is we did the first time, I think, a broadband mapping project here in California. And the carriers were great. They stepped up to the plate, and we asked all the carriers to voluntarily give us data about where they had broadband in California. So the way we did it is we had a third party gather the raw data, aggregate it, and then submit it to the state agencies. And then we GIS mapped it. And it was amazing collaboration. And what we found out, frankly, to our surprise, was that California had access, 96 of Californian households had access to broadband. This was much higher than we ever, in our wildest dreams, expected. And we found out that about 65% of Californians had actually adopted broadband, which caused us concern, because it appears that there's access in most places, but for some reason they're not subscribing. Now, my job is, I'm a PUC commissioner, so I have to try to get access to people. So I decided that 4% of California that doesn't have any access to broadband was my problem. And if you crunch the numbers, we were able to determine it's about 2,000 communities, mostly very rural, and it means 1.4 million people in my state without access to broadband. So what I did, with the support of my colleagues, is that we put together a California Advanced Service Fund. And what it is we took a nickel a month on the average telephone ratepayer bill, nickel a month, and these are all telephone subscribers, landline, wireless, cable. And for 2 years, we're going to collect this nickel a month, and it comes out to $100 million. And we are doing infrastructure grants to any broadband provider who wants to come and build broadband in our unserved and underserved communities. Underserved meaning really slow broadband. And we are hoping that this incentive program will help bring broadband to these unserved areas. And I'm really happy to report that we've had 2 rounds of filings so far, unserved and underserved. And hypothetically, if all of them were granted, we would be bringing broadband for the first time to about 108,000 households who didn't have it before. Now, I told you, though, that access is just the first piece of it. You know, the next piece is what do you do to try to help the adoption and the affordability issue. So under the leadership of President Michael Peavy of the PUC, a nonprofit organization called the California Emerging Technology Fund was formed. AT&T and Verizon very generously contributed a total of $60 million into this nonprofit. And the purpose was essentially to bridge the digital divide in 5 years. So CETF is using, so far they've granted $20 million out into existing programs, proven programs, that are going to bridge the digital divide for rural and remote areas as the first group, urban disadvantaged neighborhoods as the second group, and the third group is the disabled population who has a low adoption rate. And so just to give you some examples, CETF programs fund things like Stride Center, they used to be called Street Tech. They train street youth, you know, at-risk kids, into how to fix computers. So these are all donated computers through Goodwill. And then they take these fixed computers and they place them into community tech centers. And then meanwhile, the street youth have been trained in computer repair, and they are then able to look forward to a career in the computer industry. They've also funded programs that are placing community tech centers in affordable housing units. They're also working on having affordable housing units be required to place broadband facilities in these affordable housing complexes along with a tech center to help low-income kids have access to computers for their homework. They have required that any grantee of CETF must make all of their websites, centers accessible to the disability population to make sure that those folks can use these facilities. Another major initiative we've been doing in California is the California Telehealth Network. And I really want to give kudos to the FCC because they're the ones that started this initiative. Essentially, the FCC has a new rural healthcare pilot program that will fund 85% of the infrastructure costs for a telehealth network. And so I was out on the East Coast and I heard about this program and I rushed back to California. I was really excited and said, my gosh, we've got to do this here in California. And when I got back here, I found out that UC was going to do one because we have a fantastic telemed program over at UC Davis. And then I found out that a bunch of our rural regional telehealth networks were going to apply separately. And so under the leadership of the governor's office, we got everybody at the same table, and it was like herding cats, let me assure you. And we got everybody to agree that we were going to do a statewide single application and that we would think broader because we wanted to literally transform healthcare in California with this telehealth network. And we managed to get all of us in one application, and the great news, we got it granted. I think California was the second biggest grant. We got $22 million from the FCC, and then CETF put up the other 15%. And we now have a California telehealth network that we hope will link at least 500 sites and perhaps as high as 900 healthcare sites in California. The FCC's program emphasizes rural healthcare and tribal healthcare sites, but it also wants to include for-profit sites who will help us sustain the program after the FCC funding is gone. I have 30 seconds. Okay, we don't have much time on energy, but if anyone is interested in energy initiatives, please ask questions, and I would be happy to do some of the clean green energy, discuss some of those things we're doing at the PUC with you at that time. Thank you very much for your attention. I really appreciate it.